Caribbean Surgery Inc. welcome you to Health for Life, the first ever medical show on television that deals with prevalent health problems and concerns in an easy-to-listen to question and answer format. To find out what we are discussing today and to introduce us to the visiting specialist, here is the producer and host of Health for Life, Dr. Surendra Prasad.
Good afternoon. My name is Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical conditions. Today, we will be discussing asthma in children. My guest physician is Dr. Rohan Jabour. Dr. Jabour is the most experienced pediatrician in Guyana. Dr. Jabour, thanks for joining us on today's program. We were talking about the medications. How dangerous are the medications?
Okay. All medications are dangerous, okay, depending on how you use it. Drugs like the bronchodilators have a lot of other effect. In order to dilate the muscle wall, it stimulates a lot of nerve endings, etc. These also, nerve endings, are also in other parts of the body, including things like the heart, etc. For example, the common medication bronchodilator to be used is one called salbutamol.
Okay.
And salbutamol, as a side effect, stimulates heart activity, and also it creates tremors.
Okay.
It affects the nervous system. And so the fortunate thing that, as an experienced physician now I know, is that, thank God, kids are really versatile individuals and are meant to survive. They can tolerate a tremendous amount of drugs like salbutamol.
Okay.
However, at the same time, you can't overdo it. And if you're ending up using that medication on a continuous basis in high doses, it's eventually going to have an effect on the heart and the thing, and the child can die from overdose. Okay, it's not an easy thing to do. Okay, but it can happen if you have parents who don't understand what they're doing and do not recognize that the child is in problems. The other medications we talked about, and there are quite a number of these bronchodilators, and all of them are similar in terms of side effects, etc. The other medication that's a problem are medications like the steroids. Now, I talked about the different types of steroids. For example, the oral steroids are the most powerful.
Okay.
They act very quickly. They do the job very effectively. However, their side effects are more, because the quantity that you're using has long-term effects that will eventually, if it's used not judiciously, will eventually cause long-term effects. It'll affect their bones, their hormones, their growth, the lot, heart, lung, everything can be affected. But if it is used properly, in the way that it's prescribed, in a short term, then you will not get the long-term effects. You will not get a tremendous amount of long-term effects. It's always there, but you've got to weigh that fact that on the other side of the coin, it'll cause death if you don't.
Okay.
But once it's used properly, there's not going to be a lot of long-term harmful effects. The other thing about the steroids is that when we now use the medications like the inhaled steroids, because we can now give them inhaled, then we can still get side effects if it's not used properly. But at the same time, the amount is so small that you don't get, it's not a problem. Having said that, and we've been touting this for years, I was just reading some articles that are coming out in just last week, which the American Academy of Pediatrics, etc., they're saying that they are showing that even though we are using these low-dose steroids on a long-term basis, because we use them in a preventative manner, and at the moment that's what I do, we put them in a low dose for a period of time, and the lowest dose possible, they're seeing even that, they think that they're seeing smaller size children, it is affecting their growth. So it's something we got to look at in the future.
Okay. Now, we've talked about the dangers of the medications that are used in the treatment of asthma. You also mentioned what are some of the medications that need to be avoided. You mentioned the cough suppressants in children who are.
Yeah.
So what are some of the medications in general that parents need to be careful about using when you are dealing with a child that has asthma?
I think to understand that, you've got to realize what a cough is about. I talked about that earlier and told you that without a cough, you die. You have to have a cough. And so for a child who is asthmatic, you've got to be aware, you've got to recognize when the cough is due to just a common cold that's running its course, or when he's having an asthmatic attack. Okay. One, by looking at him, you'll see if it's asthma. And there's a simple thing that parents can do. They can simply put their ear on the child's chest, just as I do with a stethoscope, and you will hear the wheeze. You'll also see how he's breathing, and you realize that he's been coughing all night. So if you've got that type of situation, then you've got to be prepared now to go and use your asthma medicines. If, on the other hand, he's just got a common cold, then you can relax, okay? And then you can use medications like cough suppressants. But as I've said, if you go and you use a cough suppressant when he's having an asthmatic attack and his lungs are being blocked up and you're preventing him from coughing, he's going to die. Or get critically ill. He'll end up with me, and I've got to do dramatic things to open his tubes and open his airways. Okay?
So you've talked about the medications and how those medications can lead to that, but as a general discussion about what is it that can cause death in a child from asthma?
Lack of oxygen.
Okay.
With asthma, what goes on is that the tubes get blocked up. The mucus that's produced blocks all the fine tubes. The little leaves don't get nutrition, so the leaves don't work. They drop off and die.
Okay.
In a human being, the leaf, we call them alveoli. That's just like the leaves. You can't get air into them. And the other thing that happens is that air gets trapped inside, and they don't have the ability to move air. You need to breathe. When we breathe, we take air in and we push it out. We've got to be able to do that all the way down through. Okay. In asthmatic, you can't. And once that gets worse and worse and more leaves are pulled off the tree, you end up with death.
Dr. Jabour, at this point, I'd like you to summarize what are those key points you would like our listeners to pay particular attention to.
One, it is important to have the diagnosis made. Okay? Parents need to know that they have a family history of it, especially if one of them has had asthma as a child growing up. Most times in asthmatics, in children, they'll have the acute asthmatic attacks by the time they hit puberty. As they hit puberty and they get older and older, it'll get less and less. But during that time, you've got to be aware that if your child is an asthmatic, that you do not put him into an environment where he's going to get an asthmatic attack. Two, you've got to learn to recognize when there's asthma as compared to when he has a cold. And that is easy to learn. That's not a difficult thing to learn. You've got a doctor who's willing to sit with you and explain. Three, everybody in the family must know what is asthma and how to deal with it, where the medications are, how to use it, and not have it stored somewhere that you can't find when he's having a problem. Four, you've got to make sure that his environment is one that is healthy for him and will not stimulate him to get an asthmatic attack. Right? And five, recognize when he's getting into trouble that you need to get help soon and get help by people who know what they're doing.
Dr. Jabour, on behalf of Health for Life, we thank you for joining us today on this episode that dealt with asthma in children. And we look forward to seeing you again.
Thank you.
To our viewers and listeners, many thanks for joining us, and we hope that you have benefited from today's discussion. Good afternoon and have a pleasant day. Well, good afternoon, viewers, and welcome back to the program. Dr. Jabour has rejoined us into the studio. Good afternoon, sir. Let's get right into the questions. So let's talk about playing sports, exercise, and asthma. I remember previously we would say if a child had asthma, they couldn't participate, but a lot of that has changed.
Yeah, that has changed. We no longer think that way. In fact, for children who have asthma, the ideal situation is to have the lungs being exercised as much as possible. Some children will have a problem with playing sports in fields with grass, etc., especially when you're preparing for a sports event. They've cut the grass and it's freshly cut. Some children with asthma will have a problem. But on the whole, it is better for the child if they utilize that lung lung ability to open up the airways, and one of the best ways to do that is with exercise. And so exercise is not contraindicated. It's in fact the exact opposite. It's encouraged. In some cases where there are competitive sports, some of the kids will get what is called exercise-induced asthma.
Okay.
And that can be easily managed by giving them just 2 puffs of salbutamol by the inhaler or by the liquid or tablet medication, and give it to them an hour or so before they exercise, and they'll be able to perform quite well without a problem.
Very good. Now we've got a question from Yvonne in Berbice here, and she's asking, what can the parent do to slow down an asthma attack if an inhaler isn't readily available? So I guess we'll break that down into 2 parts. What should a parent do for herself, and what the parent should do for the child?
Okay. First of all, if your child has asthma, you've got to be like a Boy Scout and be prepared. If you've noticed that the inhaler is going down or is becoming outdated, you should replace it and have one on standby all the time. However, as practical in life, if a child hasn't had an asthmatic attack for 2 years and you're caught unprepared, there's some simple things that you need to do. One, for example, calm yourself down. The most important, because the parent is usually panicky, and the more panicky the parent is, the more scared the child is going to be, and the worse his asthma is going to act upon him. So the parent, first of all, got to make sure she goes and conditions herself. Look, I got to be calm. I'm a parent. I got to calm this child down. So until we can get help for him, and so calm yourself down. 2, talk to the child. Calm him down. Say, okay, you're having your asthma. You've had it before. You're going to be okay. Calm him down. Get him to breathe. Breathe slowly. Let him slow down his breathing. Slow down his heart rate, etc. And bring him into a situation where his adrenaline is not going haywire, and he can relax. And that often makes a tremendous difference. I've done that with kids in the hospital where they're really panicking, and they're on their medication, but they're just panicking with how they can't breathe. Just as a little gem, one of the things that you could use, if you've got to, give the child some coffee.
Coffee.
Yeah, caffeine.
Because the caffeine is a stimulant.
Caffeine is a stimulant and will help a little bit with the bronchodilator.
Very good.
Okay, that's just a little trick.
Now,